Hello everyone, my name is Elizabeth Lanier. The focus of my leadership project was to change our handoff reporting system on my unit to an organized huddle report during shift change. This was done in hopes of improving nurse-to-nurse communication, patient safety, and nurse satisfaction. The unit that I work on is a small specialized intensive care unit with only 6 patient beds. Often there are times when physicians ask you questions about patients, even if that patient is not yours. With a unit this small, all nurses should know pertinent information about all of the patients. Communication is lost during handoff report. It has been shown that patient handoff times contribute to informational gaps because they happen so frequently, and there's a lot of information being exchanged. Gaps in communication during patient handoff can lead to serious adverse events such as treatment and diagnostic delays, medication errors, inappropriate treatment, and omission of care. Even though handoff is supposed to provide necessary information in order to deliver patient care that is safe, patient handoff is prone to errors due to frequent communication barriers. 2/3 of adverse events are a result of poor communication. The goal of this project implementation is to improve nurse-to-nurse communication, which would lead to an increase in patient safety and nurse satisfaction. In order to implement this project, I needed a team to help me. I recruited 6 members in my practice environment to be a part of my team. These included my unit manager, 2 night shift colleagues, one of which was the charge nurse, 2 day shift nurses, one of whom is the quality assurance performance improvement team leader for the unit, and the critical care nursing educator. All of my team members played a vital role in implementing this project. As a team, we collaboratively devised the huddle sheet, had meetings for updates and feedback, made changes to the project implementation, and we're all accountable for initiating the new huddle handoff shift reporting method at shift change. So here's a little more information on huddles in healthcare. A huddle is a frequent, brief, and consistent communication among healthcare members to achieve common goals such as patient safety, patient satisfaction, staff satisfaction, and positive health outcomes. Research shows that there are many benefits to using huddles in healthcare. Huddles in healthcare are intended to improve communication, facilitate care coordination, increase workflow, promote team thinking and improve team communication, enhance satisfaction through camaraderie, improve clinical quality outcomes, patient care, and patient safety. Huddles heighten awareness of individual staff and patient needs that could be anticipated at the beginning and throughout the shift. Huddles have been recommended as a communication strategy to improve healthcare outcomes and are a great team building tool that enhances team function and efficiency. Huddles have also been shown to reduce errors and untoward events such as near misses. The aim of my project was to devise a tool that we would use and implement a new way of giving shift change report in my practice environment. By creating this tool and changing the way we give handoff report, this will improve nurse-to-nurse communication, which would improve patient safety and enhance nurse satisfaction. I created a tool, the huddle sheet, which is used for all nurses to complete for each patient for shift change. Handoff report will no longer be done at the patient's bedside, but will be outside of their room every shift change. There can be anywhere from 6 to 8 people during shift change, so this could wake the patient or be crowded in a room. Huddle handoff report should be no longer than a half hour and will occur at 7 a.m. and 7 p.m. shift changes, and all nursing staff must attend. Studies show that in order for huddles to be effective, they should be mandatory, a limited agenda should be created, they should be structured, the time should be limited, and should occur at a consistent time. This method will make entire staff aware of what is going on with all the patients, improving communication, patient safety, and nurse satisfaction. Studies indicate that the use of structured handoffs improve the quality of communication during patient handover. This is the huddle sheet that I created to use for shift change. Issues that may affect patient safety, such as drips, restraints, and certain situations should be addressed. Those patients who are at risk for falls, pressure injuries, interventions, and their effectiveness should also be included on the huddle sheet. The huddle sheet has pertinent patient information, such as the date, room number, any peripheral, central, or arterial lines a patient may have, changes in vital signs, oxygen delivery method, and any IV fluids they have running, and much more are on the huddle sheet. 2 PDSA cycles were used for this project. P. Plan. For planning, the team devised a huddle sheet. This is used on the unit for handoff shift reporting twice a day. Change of shift report is now to be a huddle report for the entire unit, and all nursing staff is to attend. D. Do. In order to do, all nurses are to fill out a huddle sheet and give information during report on their patients during handoff report. The expectations of staff were made aware from a minute's note. Signs were posted in the nurses station, the employee break room, and on the unit. My team members and I were all to observe what we saw during this project implementation. S. Study. In order to study, I obtained a baseline survey from nursing staff to determine how they felt about the current method of handoff shift report, so I could use this as a comparison for the final survey at the end. A. Act. I gathered data from colleagues and my team to brainstorm what could be done differently the next time. So for the next PDSA cycle, P, the modifications of the new huddle shift implementation were determined. We made adjustments to the huddle sheet and decided that one person would be giving report for the entire unit, and that would be the charge nurse on duty for the shift that was leaving. D, staff was made aware of the changes the same way as previously through discussion, minutes, and reminders on the unit. The team and I continued to make observations for the project adjustments. S, nursing staff was given a new survey in order to measure results from this new shift change method. A, outcome measures. It was found that the project implementation was successful as there was an overall increase in all of the goals. In order to make this change in my practice environment, the huddle sheet was created to use for shift change. This was corroborated by my team members and ultimately approved by my unit manager. Throughout the hospital, when there are updates, there are minutes notes that are written up to ensure that everyone receives updates on changes in policies, procedures, and equipment. I made a minutes note which was approved and signed by my unit manager for all staff to be aware of what was happening. This is also discussed briefly during shift changes. I made in place signs in the unit, in the nurses station, and in the employee break room to remind people of the new way of handoff shift reporting. There were many facilitators and barriers to implement this project. One of the facilitators was my unit manager being present for a morning shift change Monday through Friday, and the charge nurses being present as well. One other facilitator was that as a unit, with the help of my team members, we were holding one another accountable to initiate huddle handoff shift report. I thought that one of the barriers would be staff's hesitancy or unwillingness to implement a new shift change reporting method, but this did not occur. One of the barriers that I do suspect happening is the unit compliance for when myself, the team members, or the unit manager or charge nurses were not present, so we're not sure if huddle handoff shift report took place during these times. This project has positively influenced my practice environment. This is the new way that we are doing handoff report on the unit that I work. Almost the entire staff, including my unit manager, is satisfied. I created surveys for nursing staff to complete in order to evaluate the measures conducted on this project implementation. 11 out of 12 nurses reported an improvement in nurse-to-nurse communication as a result of this new handoff shift reporting method. 10 out of 12 nurses reported an increase in patient safety. Nurses are reporting less missed care, less patient errors, less falls, and even some nurses stated that some patients are reporting an improvement in care leading to an improvement in patient safety. 9 out of 12 nurses reported that they were more satisfied with the unit. This decreased the length of shift change time, less errors were made, and things were not forgotten. Thank you for watching.